And now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So folks, I've been telling you for years about the health care we have in Greater Hazleton, and I said the bar keeps on going up and up and up, and I'm very excited about today's show because today I'm on location at the Hazleton Health and Wellness Center right off the airport beltway here, and we're going to give you a little overview of all the great things we have in health care at this place. I'm going to start off with the Chief Administration Officer. It's always a pleasure to be here and see all these wonderful people. They're always so nice and happy. What do you give them, happy pills in the morning?
Absolutely. It's a prerequisite to be here.
Some of those pills
sure.
It's nice because when you walk in, it's a warm feeling, you know. Give us a little brief overhaul of what we have here.
Sure. We consider ourselves a one-stop shop healthcare facility on an outpatient basis. We're very excited to have this type of facility. I think you've seen our water wall. We obviously have a fireplace to create some comfort level with the patients. We offer radiology, cardiology, physical medicine and rehab. We have multiple physician office specialties here. So you can really come here and get almost everything you need done, one stop, and very convenient, right off the beltway, plenty of convenient parking. So it's worked very well for us.
So if I'm watching this and I'm going to my doctor and I do want the services here, do I have to request those services from my physician, doctor to come here, or how does this work?
Really, you just need a prescription from your physician, and then it's your choice to go wherever you feel it's most convenient, or you're going to get the high quality services, which we truly believe we have the highest quality in this region. So you get a prescription for a test. All you have to do is either call our scheduling department or just show up. We often can take walk-in patients, and we're happy to accommodate people. We understand everyone's demanding schedules, so we're here to meet their needs. We have very well, highly trained people here, all certified in their specialty, and really bring a very much caring attitude to their position here. We really look at quality and look at the whole person, and we want to make sure that their experience is very positive. As you mentioned before, they're coming here with some compromised positions and compromise and concern. And so we have to really be better than the average to make sure that we make that visit as comfortable as it possibly can be, understanding that there's a lot of anxiety whenever you're coming to get a medical test done.
And I think that's so important to have that. And as I said, the compassion that you need to have when people are coming in here. This place, when they first came here, it was a tremendous asset to Greater Hazleton area.
Absolutely.
And as I see each month, it's not even each year, how we've grown in the medical care in this area. Coming from you as the Chief Administration Officer, okay, what would you say to people as far as care? Now, I know you have a job here, and some people say, well, he has to say that because he's a job. No, I think people are concerned. If you wouldn't be working in a place if you didn't feel it was good health care.
Absolutely. As a matter of fact, I'm from Schuylkill County, and I came here by choice. I think that Hazleton, over the last 10, 12 years, has really set itself apart in this region for high-quality care. We're fortunate enough year after year to get multiple awards for the excellent standards that we set here. We're recognized nationally in the U.S. News and World Report magazine year after year for the quality of care here. So yes, I agree. I would not work for an organization where I wouldn't come for my own health care and I bring my family here for health care. So obviously I'm not going to compromise my health or my family's health. So we do a top-notch job. Now, we can't be everything to everybody. There are services we cannot provide here. But that's our partnership with Lehigh Valley. So then we refer patients that we can't handle here to them, and we have a great partnership. So the services that we provide are always high, top quality services and related to high quality staff.
Well, Bill, and it certainly shows it, okay? I wish you always the best, and all the people who work here. They're very fine people. They work hard, and it's an opportunity for people to now know in our area, folks, we have fabulous health care. So we're going to move on here today. We're going to talk to Mary now in the cardio area, and then we have some other surprises for you today that just give you a little feel. This is a little feel of what's happening here at the Hazleton Health and Wellness Center. So we're continuing our little mini tour here at the Hazleton Health and Wellness Center, and we're here in the cardio area right now and talking to Mary Alamico, who is the Director of Cardiac Services. And there's so much, I guess, that's involved here, right, Mary, in the cardiac services? But just give us a thumbnail approach here as to what you have here at the Wellness Center.
Well, here at the Wellness Center, we have all kind of services. We start with diagnosing any heart problems. We do stress tests, Holter monitors, event monitors, echocardiograms, pulmonary function studies, and electrocardiograms. So if there is a suspicion of a heart problem, this is where we come to diagnose it. If something is found and a patient does have a heart issue or had heart surgery, such as bypass or stents or a heart transplant, then they come here. This is cardiac rehab. This is where we rehabilitate those patients that have had some sort of heart disorder. They come here, this is phase 2 cardiac rehab, and we put them through all the equipment that you see here. We give them a lot of education and teach them proper diet and how to modify their behavior. So in case they have had a heart event, how to prevent another one from happening and how to fully recover from that.
Now, there's always a process, okay, of when you start, okay, if a person's, they're not feeling well, they go to the doctor. The doctor says, well, we got to go for your test, okay, and give you some certain tests. So starting from that area when you're coming in for your test, you have people here that are certified. You have the state of. We talked to Bill about the state of the art equipment here, but what else should we know? Because we're nervous enough. Because I'm the biggest baby walking the face of the earth. I'd be a nervous wreck. I came for a test one here. I thought I was going to die. Only because of my mind. But you know what? Everyone was so great. They made me feel comfortable, and I think that's so important, to make the patient feel comfortable because they're nervous the way it is.
Yes. No, we have a great staff. And it's true. People are apprehensive if they're coming for a test. We do talk to them prior to the test, just explaining what a stress test is. They're going to walk on a treadmill. We tell them what to eat, what not to eat, what medications to take. I have a great staff here. We have registered nurses, we have exercise physiologists, I have certified echocardiogram technicians, we have respiratory therapists, so I have a wide range of staff that are well qualified with many years of experience. In fact, our cardiac rehab program here is running for 25 years, and we are AACVPR certified.
What's that mean?
That was by the American Association of Cardiovascular and Pulmonary Rehabilitation. It's a big certification. It took 2 years of process to go through. That means if you come in today and you want to look at my policies or our credentials, everything is perfect.
So Mary, if we come here for a test, we're told we have to come here for a stress test or whatever, okay? Now, if something should happen, while the person's taking a test, because you don't know what would happen, what happens? What kind of backup do you have here so you're going to be okay?
Right, you don't have to worry about that. Number one, the cardiologist is there during the entire test. Mm-hmm. You have an RN there that is certified in heart there, and usually 2 RNs are present. So if something happens, the bed is right there, we lie them down, put oxygen on them, we call an ambulance. But at least we're watching. We see your heart, we see what it's doing the whole time. It's different than if you're at home walking and something happens. You're really protected here. This is a medical facility.
Now, people wonder, we always stress to go for your physical exams, okay, at least once a year. And so what do you recommend the average patient out there, the average person who's saying, well, I really don't have any problems, but there could be some brewing that you don't know about, okay? Are there certain age groups that people should be aware of if they're their 50s or 40s or 60s? I know it can happen to anybody, but right. What is like a rule of thumb?
Number one, you should start with those physical exams in your 40s. You really need to get an EKG just to see where your heart stands, especially if you had a history of heart disease. Having your blood pressure checked often. It doesn't matter what age you are. That's very important. Our doctors need baseline lab work. Those are the things that you should start following. We should start a lot younger than we do. And if there are blood pressure problems, make sure they're checked often. We allow anyone could come in here at any time and just say, I want my blood pressure checked. We have people come off the streets. even if they don't need a doctor's appointment for that. Just keep an eye on it, especially those that are known hypertensive. Take your medication. You know, prevention, number one, is the best thing.
Which you're stressing all the time, prevention. Now, let's move into pulmonary therapy, okay, which is what, you know, I have a question. What is it? What patients need this therapy, the steps such as therapy, what is this all about?
Okay, pulmonary rehab is new to us. We've been doing cardiac rehab, like I said, for 25 years. 2 years ago, we saw such a need in our area to have something for those patients that have chronic lung disease.
Okay.
Usually what we call COPD, chronic obstructive pulmonary disease. And we did a lot of research on it and decided we can do this program very similar to a cardiac rehab program, only patients are usually on oxygen and they're just a little sicker. So we keep them separated from our cardiac patients. We spend time with them. We have usually a 1-to-2 ratio. We have a physician that is here part of the time. We have RNs and we have a respiratory therapist with that patient the whole time. We have like maybe up to only 4 in a class. So we watch them real close. We monitor their O2 and teaching them how to live a better life with a chronic disease, because a chronic lung disease can be very debilitating. But what we're trying to do is just get them to be able to conserve their energy, learn how to breathe properly, educate them on the proper foods to eat and not to eat with heart disease, how to shop, how to be careful when they get up in the morning. There's so many things, and pulmonary rehab is a great support for each other because they're kind of in this boat together, as we say, and just teaching them and helping them get through their activities of daily living is big help.
And this is, you've been having this for 2 years?
For 2 years now, and they're fully monitored. We make sure we watch their hearts while they're exercising too, which is not really required in a pulmonary program. But we felt doing it in such an environment, we want to keep them really safe.
I was talking to Bill before, and it's just like so exciting to see so many things that we have, here in the greater Hazleton area. The Wellness Center just continues to, grow, and not even yearly, but there's always things happening. You're staying on top of things, the state-of-the-art equipment, the best of people that you're hiring, and of course the attitude here has just been great. All the people here are so nice and friendly. I think that's important,
We have a wonderful staff, and I appreciate you coming and talking to us.
It's my pleasure. I've been a supporter of the local health care for many, many years, Mary, and sometimes you do have to go out of town, but in most cases, 90% of the time, we have the finest doctors, we have the greatest facilities here, second to none. These people who are CEOs like Jim and Bill, they bring their families here, and what's more important to anybody than their family? So that's so critical. It's always nice seeing you.
Great seeing you.
How's your husband? Is he behaving?
Yes, he is. Good. Thank you, Sammy.
Okay, we're here at the Hazleton Health and Wellness Center, folks, taking a little mini tour. I've said this so many times, folks. We have the greatest health care around. A lot of award-winning programs they have, the greatest facilities. No reason to go out of town unless it's something very serious, and they have now the partnership with Lehigh Valley. We're going to continue our tour here, so let's continue. All right, now, folks, we're at the exercise program. Now, this is where I got to be. This is where I have to be working out. I'm going to be talking to Jared Ferentz, who is the lead exercise physiologist. That's a big name, isn't it? That sounds interesting. Sounds impressive. Lead exercise physiologist.
Yes.
Okay, what's that?
Basically, here through all of our education, we're able to work with individuals, all different ages, disabilities, modalities. So again, whether someone's a paraplegic, an amputee, a burn victim, we have the education to work with cardiac rehab, PT, OT. We can work with anybody, athletes, all ages.
There's so many programs here. Just you name some of them, okay? Are there additional programs? I know someone's having trouble speaking if they had a stroke. You have the voice people that teach them, the proper, to speak a little bit better. I mean, there's so many programs that you have here, right?
Yeah, there's a lot of programs that interchange with, again, all the different Throughout the whole building, whether it's PT, OT, cardiac rehab, there's a lot of transfer programs. We have phase 3 program that people will come from cardiac rehab up to us, and they transfer independently. We have a LeBed program, which is more, I guess you could say, people with cancer, arthritis. We have an air rope class, which is an excellent aerobic class. We have multiple weight management, again, whether it's for children, adults, or even, I guess you could say, people of all different ages, disabilities. So we have a program for everybody.
So I have a couple pounds on me that I want to get rid of, okay?
Yes.
Really, I have maybe about 10, 15 pounds that I should get rid of. Do you have a program for me?
Yes, yeah, I mean, we have...
Joe won't beat me up, though, will he?
Oh, he can. He kills you with kindness as well, too.
Yeah. No, I mean, but seriously, I mean, sometimes, you know, you get a little stagnant in your exercise program, but if I could come up here, you can give me a program that I could, you know, gradually get rid of some of this and stay in good shape.
Yeah, we start everyone off baby steps, no matter what program you start off with, ages, disabilities, anything like that. And then from there, what we do is we have programs for, again, children that are overweight, adults that are overweight, and we also have a very another program, the Alliance Weight Management, and that's more comprehensive, you know, a dietitian, behavior modification specialist. So meet with a physician, and you can also meet with us on a regular basis using the fitness center. And there's always someone here on staff to help.
You got tons of things happening here, right?
Yes.
Now we're in this program here, and I see we have some people here. What are we going to be seeing right now?
Next is going to be a demonstration of air rope. It simulates jumping rope, but there's a lot of other, again, total body exercises you can do with it. For the most part, you know, when a lot of people jump rope, what happens is that the rope hits your legs, you tend to stop, or you know, you have issues as far as balance or whatever. This kind of will prevent you from, and it keeps you constantly moving. So there's a lot of benefits to the group, and there's also a lot of total body exercises you can do.
So let's see a demonstration now. Let's see what we're doing here, and maybe you could explain what's happening. All right.
All right. You're ready. Okay, start swinging. High knees first. Ready? And go. And go back. 3, 2, 1. Backwards. And 1. All right, ready? Lunge position. And twist pulse.
Now, is this for all ages?
Yeah, all ages, all abilities. You know, even to a lot of these things, we can actually modify if anyone's not able to do something.
And I'm sure everything they're doing has a meaning for muscular or exercise, whatever.
Yeah, I mean, here you're pretty much, you know, muscular strength, power, endurance. You know, we're hitting a lot of the main components. Plus also, too, it's total body, so we're working all the muscles in the body.
And instead of jumping rope, this is a part of jumping rope. Yeah. Okay. All right. So that gives us an idea of what one of the programs you have here, correct?
Yes.
All right. Now, someone comes out here. Could they just? How do you move into a program like this?
Like I said, I mean, there's all different size dumbbells, or all different size as far as the air ropes, as far as poundage. So someone can come in this class, any shape, disability, you know, anyone in between can exercise these classes. And we work with, all the instructors work with everybody, so that way too, you don't come in, you don't feel uncomfortable, you can come right into class and everybody welcomes you in and helps you out tremendously.
All right. So this is part of the one of the jump rope programs. I can just see me out there jumping. All right, thank you very much. So in addition to different programs, okay, Joe is now going to do a demonstration, right?
Yes.
Okay, now just exactly what will Joe be doing, what is this demonstration?
This is going to be the athletic edge. For the most part, Joe's going to demonstrate a lot of functional exercises, which are excellent for athletes or people of all, again, ages, disabilities. You know, it trains the muscles in a lot of different ways that are very functional to a lot of activities you can do in recreational facility or even outside.
Okay, so Joe, let's see your demonstration here, okay? And this is what I taught him this morning, folks. So,
all right, guys, you ready? We got sandbag squats first. You got the vest on, okay? So we got Allie here wearing the vest, and begin, go. Allie's wearing the vest. We got a sandbag. It's almost like it has filled up with sand, and that's filled up with rocks that actually are next to each other. So you need 2 more. 2.
And now what is this actually doing for the person right now?
Like I said, more or less strengthening the upper body, lower body, utilizing all the muscles in the body, functional exercise. And this program is, like I said, designed for athletes or people of all different ages and abilities.
Okay. Now we're seeing younger people here, okay?
Yes.
So I don't want people to get the impression that it's only for the young people, okay? This is for any age, correct?
Yeah, any age, any ability level. I mean, you can get a group of people that come in here and exercise that are just starting off, and we can work with everyone.
Yeah, so I mean, I know these kids look, they're in good shape, but the point is that if a person like me or a person, any age group or can come in here, and then there's a work program for them, correct?
Oh yeah, there's a program for every person, every age, every ability level. We start off here real slow and we'll work your way up.
That's something I have to begin to do is push-ups. I don't know how to do push-ups.
Yeah. 15.
Okay.
Ready?
All right.
And begin.
And folks, if you just tune in, we're here at the Hazleton Health and Wellness Center, and we're doing sort of like a mini, tour of what's available here. As you can see, there are so many opportunities to keep yourself healthy, and they're here in the greater Hazleton area. You can certainly give them a call up here, and they'll be more than happy to fill you in a lot of things that they're doing, the different programs. Now, you have a ARC trainer here, correct?
Yes, correct.
Let's go there and see what this ARC trainer is all about. So we're talking about state-of-the-art equipment, right? Now, this is the ARC trainer. What is this?
This right here is the ARC trainer. For the most part, it's featured on a national weight loss show. It's also featured on a lot of the professional football teams of all different abilities and levels. They use that. It's designed for people of all abilities. But what it is, it eliminates a lot of pressure off the lower body, and you get a very beneficial workout. As far as what they claim is that you burn about 16% more calories than a normal elliptical.
Okay, so here again, I see all this equipment here,
Yes.
all right? And sometimes I get confused, and I get, do I do this? Do I do this? Do I do this? So the average person says, will I know what to do when I come up here and they start a program for me? Okay.
Yeah. As far as that goes, I mean, everyone that comes through here, we do an evaluation process, but during the evaluation process, you also get appointments. We'll take you through on all the pieces of equipment, show you how to use it, how to do all the programs, and basically depending on your goals, background, experience, what machines you can stick and aim towards.
Okay. So they have a program here for each one of you. I was just telling Joseph before, I'm going to be coming up here along with my wife and starting a program because I'd like to get a couple pounds off, and not that I become a muscular athlete, but just to stay healthy a little bit and keep going. And I think it's a good opportunity to start you from scratch, for example, and then you build right up. Correct?
Yeah, everything's all individualized, no matter what a person's background is or even experience level. We work with you and we'll build you up. I mean, we don't like to ever hear the word can. I mean, for the most part, we'll start you off and we'll build you up.
Oh, you're going to be in for a treat with me, pal. Okay. I'll tell you that right now. Folks, we're here at the Hazleton Health and Wellness Center doing a mini tour, and we're going to continue on with our tour. So we talk about state-of-the-art equipment and what's happening here. This is exciting for you women. Joined now by a friend of mine who was on our show before, Dr. Sandra Denise. How are you, doctor?
Good. How are you?
Good. Everything's okay? Your husband's behaving here?
Yes.
I know. Now, what we're going to talk about today, okay, is exciting. So why don't you just give our viewers a brief description of why this is so exciting to our area now.
All right. So, hi everyone. What we're going to talk about today is that finally here at Hazleton, we will be able to do at the Wellness Center stereotactic biopsies for the breast. And before we were sending people somewhere else because we didn't have the equipment, but now it's here, so now we can provide this to every patient when they have an abnormal mammogram and the biopsy is to be done by a stereotactic machine. We are able and capable of doing it here at Hazleton.
So this is the actual machine, correct?
This is the actual machine.
Now, before the female is on here,
yes.
You say they have a mammogram?
Yes,
okay.
every female should have a mammogram every year.
Okay, so they have their mammogram, okay, and you find something that's a little abnormal, okay?
Correct.
What's the next step then?
So depending on the abnormality, some women will get a follow-up ultrasound, which is this other machine that we have here. And we see where this abnormality is seen best. Sometimes it is seen best on the mammogram, and sometimes it's seen best on the sonogram. Based on how it is best seen, then we do a biopsy.
Okay, and so then it goes another step after you see that. What is this machine? When do you come here?
So if you have an abnormal mammogram and you are scheduled to have a stereotactic biopsy, you get to come to this machine. And in this machine, the woman will lay facing down. We would put a nice pillow over here, and I would be standing somewhere in that side, and we would place whichever breast that needed to be biopsied in this space. And then down there is where the machinery is that we actually do the biopsy with. So
now this does not hurt, does it?
It always bothers at the beginning. Mostly the one thing that bothers the most is just local anesthesia. When the anesthesia is in, which is about 10 seconds of a wasp burn, then it goes away, and that's about it.
But the most important thing is this is so critical now to our area, because before they had to go out of town.
Yes.
And now it's here.
Now
correct?
it's here.
Okay. So after you do this and you find, whatever, okay, this is another step to see if there's something that's
needs to be done extra. So out of the 100 biopsies we do, 95% of them, so 95 out of 100 women will have something that it's not bad. And that's it. That's the end of that.
And if there is, okay, there is such advanced surgery, advanced medical surgeries that are available.
Yes.
Talk a little bit about that.
So the idea of doing your mammogram every year is that you get to catch things that are really, really small and do a biopsy then and take them out of your body before they become harmful to it. So that is the greatest advantage of the mammogram, is catching things that are 2 millimeters big, which is less than half a pea. And so you get that out and you're pretty much done with everything, which is when you want to catch these things.
Well, folks, as I said before, when I had Dr. Denise on the show, she explained a lot about what she does, etc. And I told you before, and I'm not patronizing you, but we're hearing some great things about you, Doctor.
Thank you.
And it's it's so nice to have you and your husband in our area. Bring so much talent to us, okay?
Thank you.
You're doing a great job. Okay, folks, I'm here at the Hazelton Wellness Center, Health and Wellness Center. As I said to you before, we just only touched a little bit of what's happening here. There's so many great doctors, so many great people work here to comfort you and to give you the best of health care. It's just something that, we're blessed to have, and I have to hats off to the Greater Hazelton Health Alliance. I'm Sam Lesante. You have any questions, 24/7, ssptv.com. You can watch all of our shows, all of the health shows we've done. Just go to our website, hit shows, Sam Lesante Show. All of the health shows are there. We'll see you next time.